Okay, hello. This video deals with a review of the pharyngeal arch derivatives. Some nasty embryo stuff. Alright, in the movie Waterworld, Kevin Costner had gills. You can see him right here. Kind of a far-fetched thing, but in reality, as developing embryos, we do have what are called gills or branchial arches. The word branchia is Greek for gill. Don't confuse it with a brachial, which means arm, but branchial. So as little fetuses, we do have gills. So some people believe that ontogeny recapitulates phylogeny, meaning that embryological development mimics our evolution. Ooh, wild. Why do we have to study these pharyngeal arches? Well, here's a med student that posted this. He says, all my friends said that they didn't have embryo on their test on the board, so I didn't study it much. Well, that wasn't smart because I had about 5 or 6 questions. 2 of them were asking about pharyngeal arch, pouch, and groove stuff. So there are some questions on this stuff. Here's another note. Are those questions a bit hard, or is it just me? All right, those pharyngeal arch derivatives have to be one of the most meaningless things we are forced to study. I didn't even know they existed until I started reviewing for the board. So let's see if we can learn anything. All right, what is a pharyngeal arch? Well, if you make a coronal cut through an embryo that's about 5 weeks old, right about this level. Okay, this isn't an embryo, it's a raisinette, a chocolate-covered raisin. But it sure looks like an embryo, doesn't it? All right, here are some drawings of embryos. And at about 5 weeks, we look like this. Kind of our head bent down. But if you make a coronal cut here through these little lumps, which are pharyngeal arches, and flip this section up, it'll look like this. This groove corresponds to the mouth. This corresponds to the pharynx. And you see a series of masses or bumps here, and these are pharyngeal arches. This would be arch 1, arch 2, arch 3, arch 4. Arch 5 immediately degenerates, so you don't have an arch 5. And then there is down below an arch 6, but usually 4 and 6 are talked about or lumped together when you talk about those arches. So it's arch 1, 2, 3, 4, 6. And you can see here on the embryo, here's the embryo curled up, and there's a coronal section through the arches. So right through here, so you have arches on this side, arches on this side. What else do you have? Internally, you have pouches. So you're going to have a pouch here, a pouch here, a pouch here, a pouch here, which are numbered. Externally, you have what are called clefts. So you have cleft 1, cleft 2, cleft 3, cleft 4. The only cleft that's really important is cleft 1, which contributes to the external auditory meatus. The other clefts are obscured by growth of the second pharyngeal arch. So the only clinical significance with cleft 2, 3, and 4 is that you could get a cyst or a fistula formed at these levels here when this tissue grows down past it. So you could have a fluid-filled cyst, or you could actually have an opening into the pharynx. And this is a little later here, and you can just see the same thing. Arch 1, arch 2, arch 3, arch 4, 6. We can kind of lump 4 and 6 together. Pouch 1, pouch 2, pouch 3, pouch 4, 5. And then here we just have cleft 1. The other clefts are obscured. Just another drawing kind of showing the same thing. Arch 1, arch 2, arch 3, arch 4, 6. And each arch is going to have a nerve, artery, vein, and cartilage associated with it. And here we can see there's a few little mnemonics here. Once again, here are the arches. The arches are the whole bulge here. The bulge is the arch. The indentations between arches on the outside are called clefts. On the inside are called pouches. And here we have that here. Branchial clefts are derived from ectoderm. What else comes from ectoderm? The nervous system, right? So on the outside here, the clefts are lined with ectoderm. Arches have everything in them. They're going to have mesoderm, and they're also going to have neural crest tissue. The bones in the cartilage in the pharyngeal arches are from neural crest. So neural crest cells migrate in to make the cartilages of the pharynx. And the pouches are derived from endoderm. Kind of makes sense. You're in past the mouth, so everything in here is going to kind of be lined with endoderm. So it's ectoderm cleft, endoderm pouch, and in the arches themselves are going to have all three. They're going to have mesoderm and they're going to have neural crest. They're going to be lined with ectoderm and endoderm. And the arch itself is going to be mainly mesodermal, muscle, connective tissue, and it's some neural crest that migrates in. And a key thing you can start chanting now, since we have arch 1, arch 2, arch 3, arch 4, 6, is the associated cranial nerves are 5, 7, 9, 10. So just keep saying that. 5, 7, 9, 10. 5, 7, 9, 10. 5, 7, 9, 10. Arch 1, 2, 3, 4, 5, 7, 9, 10. Remember that, and it's going to get you far, because you remember what 5 innervates, what 7 innervates, what 9 innervates, what 10 innervates, and that'll give you a lot of information about the pharyngeal arches. Think of the arches in terms of action. Well, kind of. Chewing, arch 1, 5, muscles of mastication. Arch 2 is 7, so facial expression. Arch 3, the only muscle in arch 3, done by the glossopharyngeal stylopharyngeus. Arch 4, 6 is for swallowing and speaking, and that's done mainly by 10. And there's a little mnemonic here you can look at. I don't know if it makes sense. One man sat chewing, arch 1, 2 hands on his face, arch 2, facial nerve. The third with his pharynx, well, the third arch deals with stylopharyngeus. Swallowed the fourth plate, speak up. That's 10, dealing with swallowing and speaking, and the rest of this makes no sense to me at all. This is a nice drawing by a med student named Ray Cheong, and it's basically just a snowman on speed here. Instead of 3 bumps, 1, 2, 3, it has 5 bumps. And these correspond to the pharyngeal arches. And remember, this is one side. There would be the other side with the food tube going down the middle here. So this is arch 1, arch 2, arch 3, arch 4, 6. Many texts lump these two together. Remember what I said about the clefts? The key cleft here is cleft 1 for the external auditory meatus. Let's get some color going here, because we can. Alright. Let's look at the clefts on this side. Like I said, the only cleft we really care about is cleft 1. This is cleft 1, and that's the external auditory meatus. Let's look at the pouches on the other side here. What comes out of pouch 1? Remember, that's endodermal. It's mainly the middle ear and the auditory tube. Okay? What comes out of pouch 2? Palatine tonsil. What comes out of pouch 3? This is board's question stuff. You get the thymus, remember, which migrates down to sit upon the heart, a source of T cells, and you get the inferior parathyroids. That's important. Here's pouch 4. you get the superior parathyroids. Isn't it? It's kind of weird, and it's a point you got to remember, that the inferior, the lower parathyroid, so let's draw a thyroid gland, say, right here. Okay, here's a thyroid gland. Kind of looks like a butterfly. And we kind of have this waltz of the parathyroids. So the inferior parathyroid comes from pouch 3, and it's going to go low in the thyroid here. And a superior parathyroid comes from pouch 4, and it's going to go high in the thyroid, right here. What are parathyroid glands for? They put calcium in the blood. Okay, so remember that. You got that little waltz of the parathyroids. The ultimate brachial body comes from pouch 4, 5, down here. We could say 5. And though the ultimate brachial body is a fancy, ugly word, it just refers to the C cells of the thyroid. What do? They calcify. They take calcium out of the blood and put it back in bone. So they're going to be up here in the thyroid. How the heck did the thyroid get down here on the thyroid cartilage? It used to be up above the tongue. Remember? So why don't we just, for SNCS, we'll draw a tongue here. Here's a tongue. Boop. There's a groove. Boop. So that's a tongue. Here's a mouth. Put some teethuses in there. The thyroid used to sit up above the back of the tongue, right? Comes down and migrates through foramen cecum through the thyroglossal duct and makes its way, it doesn't detour like this, but it does make its way down to sit on top of the thyroid cartilage. So remember that your thyroid migrates down like that. And you can get remnants of thyroid tissue anywhere along its course in the neck, that midline migration. So we did pretty well there with the cleft, one cleft we care about. Now these other clefts that are closed up when the second pharyngeal arch grows down and obscures them, they're clinically important because, as I mentioned before, they could be a site of a cervical sinus, so you could get a little trapped bleb of fluid or something. And if it's really bad, you get a fistula, which is a continuous channel right into your pharynx. All right, why don't we clear this confusing picture right now? It's making me click that twice. Clear all ink on slide. All right, let's go back and talk a little bit more about the connective tissues in the arches themselves. All right, arch 1, what nerve? 5. Arch 2, 7. Arch 3, 9. Arch 4, 6, 10. 5, 7, 9, 10. Here he gets a little fancy and separates the superior branch of the vagus from the recurrent laryngeal, but that's kind of fancy. Okay, so 5, 7, 9, and 10. 5, 7, 9, 10. Don't forget that. All right, what kind of connective tissues do we see here? Well, in arch 1, we're going to see the maxilla, the mandible, the zygoma, the malleus, and the incus. Think of the muscles that attach to these, and those are mainly innervated by the trigeminal, arch 1. Arch 2 connective tissues. Stapes, remember the stapedius muscle, innervated by 7. Styloid has stylohyoid ligament, lesser horn of hyoid. These all are arch 2 derivatives. And these are from neural crest, remember? Any muscle bone of the pharyngeal arch region is done by neural crest. Hyoid bone, arch 3, 9th cranial nerve, hyoid bone. Thyroid cartilage, cricocartilage. All the muscles here are innervated by 10. That's arch 4, 6. 4, 6. How about the muscles? And we just kind of mentioned them. 5, 7, 9, 10. So arch 1, muscles of mastication, anterior belly digastric, tensor tympani, tensor belli palatini. These funky muscles start with a T, so that's why they're trigenital. We move to arch 2, muscles of facial expression are done by 7. Posterior belly to digastrics done by 7. Stapedius attached to the stapes done by 7. Stylohyoid off the styloid process done by 7. So that's arch 2 muscles. Arch 3 muscles, only 1, stylopharyngeus. And arch 4, 6 muscles are going to be those of the constrictors and the larynx. Lump them together. I don't think the boards are going to separate those. And finally, we'll show you some pictures in a bit, but arteries associated with each arch. The maxillary artery plows through the deep face where you see the pterygoid muscles, etc., innervated by the trigeminal. So maxillary artery is an arch 1 derivative. Arch 2 is the hyoid artery and stapedial artery. Do you know what they are? I've never heard of them. Arch 3, the carotid, comes from arch 3. Carotid, root of internal carotid. So that's kind of important. There are arches, aortic arches associated with all these that regress in development. A key point to remember, arch 4 gives you the aorta and the right subclavian artery, arch 4. Sprouts of pulmonaries, I put those on a sandwich this morning. Not important. And if you want to get picky, from arch 6 comes the ductus arteriosus, arch 6. But the key ones for boards probably would be the carotid from arch 3, the aorta from arch 4. All right, that pretty much takes care of this picture. So let's clear that and go back to the pointer. And you can read this on your own. Once again, cleft 1 is the important one. Pouches. Remember, pouch 1 contributes to the ear. Pouch 2, tonsil. Pouch 3 and 4 are parathyroids, with the inferior coming from 3 and the superior coming from 4. And also the thymus comes from the 3rd pouch. And the thyroid gland comes way up from the tongue and comes down. You can read about some of these things that can go wrong here. There is a syndrome called DeGeorge syndrome. It's a deletion on chromosome 22, and it leads to a problem with the immune system, a T-cell deficiency. It's really a pouch 3 problem, and that's why you're going to lose some of the parathyroids, and you're going to screw up the thymus. DeGeorge syndrome. Another nice table. You can look at this. It lists the abnormalities here. There's an important one here called Treacher-Collins syndrome. It's a first arch problem. Trigeminal nerve. It's a failure of neural crest cells to migrate in. So you're going to have problems. You're going to have a very small or missing mandible. You're going to have facial bone problems. And I have a picture coming up. We give a special name to the primordial cartilage in arch 1. It's called Meckel's cartilage. The primordial cartilage in arch 2 is called Reichert's cartilage. And that's what this drawing is shown here in red. This is Meckel's cartilage. Contributes to the mandible and 2 of the ossicles. Remember, the stapes is attached to the stapedius muscle. So that goes with arch 2. And in arch 2 you see Reichert's cartilage in blue here. So that's the lesser horn of the hyoid, the styloid process, and the stylohyoid ligament. So it's Meckel's cartilage and Reichardt's cartilage, arch 1, arch 2. And in arch 3, there's no special name, but you have the rest of the hyoid. Again, nerves, associated nerves, 5, 7, 9, with 10 being down here. This picture is just nice because it shows the primordial aortic arches. They're like ladders. You have a ventral and dorsal aorta, which twist and regress. A lot of these ladder rungs disappear. And the key ones that persist is the fourth arch, remember, said makes up the aorta, and the right subclavian. The sixth arch contributes to the ductus arteriosus and some of the pulmonary artery. The third arch plays a role with the carotids. So those are the key ones to remember here, 3, 4, and 6. And again, this is kind of repeating that. There's a little mnemonic here that might help you. I don't know. First arch is maximal, maxillary artery. But here again, it breaks down and kind of shows you which arches. This is arch 3 for the carotids, arch 4 for the aorta and part of the right subclavian, and arch 6, a little bit of the pulmonary artery and the ductus arteriosus. Things that can go bad in development here, coarctation, where you can actually have a narrowing or a blockage of the aorta, and that can be postductal or preductal. And you get different, you'll get different alternate routes depending on where that blockage is. You can see how the intercostals and the internal thoracics can help bypass that blockage. I mentioned the thyroid here, develops above the tongue, travels down foramen cecum to find the thyroid cartilage. A quick note on cleft lip, failure or fusion of the maxillary and medial nasal processes. Cleft palate, failure or fusion of the lateral palatine processes, the nasal septum, and the medial palatine processes. I think this is worth memorizing. It's confusing to think about, but if you memorize this paragraph, I think you're going to get a question right. This drawing is just referring to the development of the pituitary gland. The key word here is Rathke's pouch. That's contributing to the glandular part of the pituitary gland. So Rathke's pouch grows up to meet a diverticulum, which grows down from the brain proper, and the two come together to form the adenohypophysis of the pituitary gland. And of course you have a neural part and you have a glandular portion. Here's the optic chiasm. All right, here's some quick true-false questions. See if you can answer these. The second pharyngeal arch gives rise to the muscles of mastication. I know. The trigeminal nerve grows into the first pharyngeal arch. The superior, laryngeal, and recurrent nerves grow into the fourth and sixth pharyngeal arches. The split innervation of digastric muscle. I'm not going to read these. Pause the tape and see if you can answer these, damn it. And here's the answers. The second pharyngeal arch gives rise to the muscles of mastication. That is wrong because the second pharyngeal arch is innervated by 7, 5, 7, 9, 10. So that's muscles of facial expression. The trigeminal nerve grows into the first pharyngeal arch. True. The superior, laryngeal, and recurrent grow into the fourth and sixth pharyngeal arches respectively. Yeah. That's picky. Remember 10 with 4, 6. The split innervation of the digastric muscle reflects contributions from the first and second pharyngeal arches. Yes, indeedy, because that would be trigeminal and facial. 5, 7, 9, 10. Remember, anterior belly digastric, 5. Posterior, 7. The tympanic membrane is at the fusion of ectodermal and endodermal layers. Darn straight it is. It's cleft 1. So the cleft 1 ectodermal tissue merges with the pouch 1 endodermal tissue. The transition from arch 1 to arch 2 occurs within the region of the middle ear. True. The muscles of facial expression derive from the second pharyngeal arch. Yes, indeedy. The stylopharyngeus muscle is the sole muscle from the third pharyngeal arch. Yes. 5, 7, 9, 10. 9 does the stylopharyngeus. The fourth and sixth pharyngeal arches, missing, gives rise to the cartilages of the larynx. The fourth and sixth, yes, 4, 6, larynx. True. The superior, middle, and inferior constrictors are derived from fourth and sixth pharyngeal arch and innervated by the vagus nerve. This is very, very picky, and I don't think you got to know that the separation between those two nerves, but it is false. Do know that 4, 6 is done by 10. A 5-year-old girl is thoroughly evaluated because of growth failure. The child has been complaining of headaches, which are exacerbated when she tries to read. Fundoscopic examination reveals papilledema. That would be problems with the optic disc, swelling. CT scan demonstrates a mass involving the area above and within the sella turcica. What sits in the sella turcica? The pituitary, right? Surgical resection of the mass yields a multioculated cystic and solid tumor containing dark brown oily fluid. The tumor is thought to arise from epithelial rests derived from which of the following structure? A rest refers to a embryonic cell that persists into adulthood. Where did it come from? Well, it didn't come from the neural pituitary gland. It came from the glandular portion, which comes from Rathke's pouch. Correct answer is D. The tumor described is a craniopharyngioma, which is one of the more common brain tumors of children. It comes from Rathke's pouch, which is an oral invagination, gives rise to the cells of the anterior pituitary gland. They resemble ameloblastomas, which are tooth tumors. And you can read the rest of this. A neonate does not pass meconium, that's the first poop, until 48 hours after his birth. 2 weeks later, his mother reports that he has not been passing stool. Anal rectal manometry reveals increased internal anal sphincter pressure on rectal distension with a balloon. Radiographic studies reveal massive dilation of the colon. This child is gravely constipated. The findings in this case indicate a developmental abnormality of which of the following embryonic tissues? Think about it. Is it ectoderm, endoderm, neural crest, neural splanchnic, mesoderm? The correct answer is neural crest because this person, the infant, has Hirschsprung disease, which is due to an absence of ganglion cells. Remember myenteric plexus, our box plexuses in the colon? These are from neural cleft cells. If they don't migrate, you're not going to have any movement of the colon. This is called Hirschsprung disease. Choice A, ectoderm forms the epidermis of the skin and the parenchymal cells of glands associated with the skin. It also forms most of the nervous system. Endoderm forms the epithelial lining of the gut tube and the parenchyma of glands associated with the gut tube, such as the liver and pancreas. Neural ectoderm, I kind of mentioned that there, forms the CNS, the somatic motor neurons of the peripheral nervous system, and the preganglionic neurons of the autonomic nervous system. Splanchnic mesoderm forms gut muscle and membranes, the visceral peritoneum, the visceral pleural, the visceral pericardium, and the stroma and muscle of the wall of the gut. A 56-year-old man develops an aortic aneurysm at the origin of an artery that arises from the aorta at about T12. Which of the following is not? negative, a derivative of endoderm, but is supplied by this artery. So something here must be mesodermal probably. And it's supplied by something around the celiac axis. What's by the celiac axis? We have hepatic, we have splenic arteries and gastric arteries. And I believe that the spleen is mesodermal. It's full of blood. It eats up blood. So the correct answer is spleen. The spleen is mesodermal and it's supplied by the splenic artery. An investigator develops a marker that is selectively expressed by the nodal cord of a developing embryo. The marker is identified by spin-labeled MRI. Which of the following represents the earliest possible week that the marker could be visualized? They want to know, when are you going to see the nodal cord? That's about the third week. You get a bilaminar disc, primitive streak, bilaminar disc, nodal cord, third week. The baby's Weber are accidentally switched at birth. One of them exhibits respiratory distress and hypoxia secondary to a constricted airway, as well as severely the face is messed up. Genetic testing performed to determine who's who reveals an inactivating mutation in the TCOF1 gene, and a diagnosis is made of Treacher-Collins syndrome, a rare disorder characterized by malformation of the first branchial arch. So you don't get, the crest cells do not migrate into arch 1, the trigeminal nerve arch. Which of the following is likely to be unaffected? So they want to know which of these is not in arch 1. Incus, arch 1, malleus, arch 1, mandible, arch 1, tensor, tympani muscle, done by the trigeminal arch 1. Stapes is arch 2. Right answer is B. By performing a tonsillectomy in a 9-year, we think arch 3, right? Tonsillectomy, arch 3. A 9-year-old girl with repeated upper respiratory infections. Arch 2, we think of, right? With repeated upper respiratory infections, the surgeon mistakenly cuts a nerve running in the tonsillar fossa. That's the glossopharyngeal nerve, remember? Leaving the girl with decreased sensation over the posterior 2/3 of the tongue. Actually, it's posterior 1/3 of the tongue. Cell bodies will likely undergo degeneration and nucleus of nerve associated with which of the following arches? Glossopharyngeal nerve is arch 3. Right answer is C. Those are the answers to those questions. A premature infant develops progressive difficulty breathing over the first few days of life. Deficient surfactant synthesis by which of the following cell types may be contributing to the infant's respiratory problems? All right, so we're just jumping ship. I'm throwing out a couple weird questions. Which cells produce surfactant? Well, isn't it the type 2 pneumocytes? Correct answer is E. If the child's born too early, they're going to have a problem with surfactant production. They can have hyaline membrane disease. Inability of immature lungs to synthesize surfactant. You can read these others. The most common site of a thyroglossal cyst is, what is a thyroglossal cyst? Thyroglossal cyst, remember, is a little bubble bleb, could be fluid filled, and it's left in the thyroglossal duct. It's a little opening, a remnant of the thyroglossal duct, which is formed when the thyroid descends through foramen cecum of the back of the tongue. So where is it located probably? I'm going to guess midline because the thyroglossal duct is a midline structure, and that is correct. Most common site of pharyngeal fistula. Now remember, I mentioned fistula in relationship to a cleft 2 or 3 problem, and that's on the side of the neck. So it's going to be dorsal, no, anterior border SCM, superior midline, close side. I would say anterior border of SCM is kind of on the lateral side of the neck. That is correct. Most common congenital malformation of the head and neck. Which of these is most common in a malformation of a newborn? Anterior cleft, posterior cleft, palate, thyroglossal duct cyst, unilateral cleft, ankyloglossia. That's when your tongue is kind of fused to the floor of your mouth. I believe the answer is unilateral cleft. D, unilateral cleft. This is an example of a unilateral cleft right here, which can be easily repaired once the child is allowed to mature a little bit. Most common arterial malformation in infants: abnormal right subclavian artery, double aorta, right aortic arch, coarctation of aorta, patent ductus arteriosus. It is patent ductus arteriosus. An infant born to alcoholic mom had microcephaly, small head, and cardiac abnormalities. During which of the following is alcohol most teratogenic? Don't they usually say stop the booze in the 5th week? So I'm going to say 3rd through 9th. The answer is B, and it is B. Don't drink in that 5th week. A 60-year-old woman had the sudden onset of weakness in her right arm. We're going to throw a neuro question at you. 68-year-old woman has sudden onset of weakness in her right arm and leg. So it's probably a weakness and not total paralysis. So it's probably an upper motor neuron lesion on her right side. So we think left side stroke or right side medulla problem. Left side medulla problem before it crosses. She can speak, but her words are not enunciated clearly. Neurological examination shows an extensor plans. There's a positive Babinski. When she is asked to protrude her tongue, it deviates to the left. It points toward the side of the lesion. That's what it does. So we know there's a lesion on the left side in the medulla probably. And the muscle in the left side of the tongue shows atrophy. Which of the following labeled areas in the brainstem is damaged? Her weakness is on her right arm and leg. The tongue points to the left. So here's the pyramids. This is the medulla. Pyramid is not crossed yet. Here's the hypoglossal nucleus. The tongue is pointing to the left, so the odds are the lesion is here. So if we cut the pyramid here on the left side, it's going to affect the right side of the body. But the tongue is going to point toward the left because the lesion is over here. So the correct answer is B, uncrossed pyramid and left 12th nerve. Remember, the pyramid doesn't cross till just about the spinal cord. So if you cut the pyramid above its decussation, it's going to affect things on the opposite side of the body. And that's it. A little long, sorry, but there were a lot of questions there. Over and out.